Southwest Florida Urologic Associates have been here in Fort Myers since 1974, and my partner, Dr. Castellanos, started the group. We have 8 doctors here in Fort Myers, and we have 4 different offices. We have one here in Fort Myers, one in Cape Coral, one in Lehigh Acres, and in Bonita Springs. Southwest Florida Urologic Associates are affiliated with the Lee Memorial Health System as well as the Lehigh Acres Health System. We have 3 hospitals in Fort Myers, 1 in Cape Coral, and then we go to also to the hospital out in Lehigh Acres. All of our doctors are board certified, and we feel that it's very important because we want to bring the best doctors we can and maintain the best care we can for our patients. We all practice general urology, but we do have areas that we all specialize in. Dr. William Evans, he is one of the senior members of our group, and he practices general urology as well as has a special interest in infertility and difficult cases of incontinence. Dr. Mintz and Dr. Benitez do a fair amount of pediatric urology as well as practice general urology. Dr. Rizzo specializes in general urology and incontinence and female urology. I am a urologic oncologist. I do mainly cancer work. My partner, Dr. Strickland, does a lot of percutaneous kidney stone work, and Dr. Borden as well as does a lot of percutaneous kidney stone work. We all see each other's patients, which is kind of a unique thing in our group, so that you usually have more than one person looking at each patient. So we're not, especially if somebody goes in the hospital and say one of us does an operation on them, 2 or 3 different doctors may see that patient that week, and that way that patient gets 3 different minds working on their particular problem. And I think that gives the patient better care and usually a better outcome. We have our own surgical center, which has been open for the past 6 years. We do a lot of endoscopic work there. We also do minor procedures. We have our own lithotripter where we treat kidney stones. We find that, having our own center gives us a little more personal touch. The patient doesn't have to go to the hospital where they kind of get lost sometimes, and we're able to kind of control that a little bit better. I think we give them better care, and they have better outcomes by going to our own surgical center. We see a lot of different conditions of the urinary tract. We see prostate disease, the benign enlargement of the prostate, as well as prostate cancer. We see a large amount of kidney stones because kidney stones are very prevalent in this area due to, it's very hot. We're in what we call the stone belt here. We treat them medically as well as surgically. We treat incontinence, which is leakage of urine, mainly in females. We also treat cancer of the bladder, cancer of the kidney, cancer of the testicle. We also treat infertility. We've handpicked all our employees, and we take a lot of pride in taking very good care of our patients. When a patient comes to the doctor's office, he or she is very apprehensive. They usually come with a problem, they're afraid. We try to put them at ease. We try to, make every patient feel special. We try to show each one of them compassion. We try to spend the time that it takes to find out what's wrong with that patient. And that's probably one of my, my favorite parts of medicine is the personal interaction that I have with patients every day and working through a problem with them, meeting them, finding out what's wrong with them, diagnosing their problem and treating them, and then letting them, sending them on their way. And that's probably one of the most satisfying things you can, that I find in my life today.
Southwest Florida Urologic Associates, compassionate physicians, comprehensive care.